Okay, thank you.
So don't say anything bad about me now because you're being recorded, okay?
Nope, we're all good.
Is this the team we're going to be talking to today?
Yeah, yep, we're
Okay.
good.
Okay, great. Well, thank you so much for joining us. We were just talking about the weather, and I used to live in Ohio, and I traveled back and forth to Michigan quite a bit, and I don't miss the weather that you guys have, except in the summertime where it's 122 here in Phoenix. So that I miss it.
Right. Always good and bad.
Okay, so what we're here to talk about, well, first of all, I want to apologize. Andrea was driving to a meeting this morning, and a friend of hers was going there too, and she was going up the highway, and there was a 15-car accident. And her friend was like the second car in the top of the accident, so I'm not quite sure what happened yet, but her car got totaled, and Andrea happened to see it and pulled over and waited because it was 32 degrees out or something, pulled over and waited for her. So she may be able to pop in here in a little while, but she wanted me to let you know that she apologizes. She usually likes to kick off these things.
Not a problem. Hopefully everybody's all right.
Yeah, so far, yeah, they just called and they're both okay, so all is good here. Okay, let's go ahead and get started here. First of all, I'm going to warn you that this program or this presentation has been nicknamed "A Drink from a Fire Hose." There's a whole lot of information that we're going to get through in about the next hour, and it's a lot coming at you. So please feel free to stop me. I put a bunch of screens in here that says questions, so that if you have any questions, stop there. But if you have a question on the way, please feel free to stop me. So, coming off of COVID, we've had a lot of health departments. We had one health department that had 90% turnover. They got on the presentation for the training, and all 9 out of 10 people were new on the training here. So a lot of turmoil, a lot of turnover, and now a lot of new people coming into public health are trying to understand, what public health is all about. And we kind of see it like this, that all of the things are up in the air at this point in time. VMSG is a tool that allows you to organize everything in the department, including your accreditation. So are you guys going for accreditation, reaccreditation, or none of the above?
We are only pursuing the Michigan accreditation.
Michigan accreditation. Okay, so yeah, we have that plan built into the system as well.
Okay, I thought so.
Yeah, at some point in time, again, if you want to go through FAB accreditation as well, which a lot of departments do, then we have the FAB plans all built in there as well. And I'll walk through those with you in a minute here. Idea is that from here, as you get things implemented in the system, you kind of end up looking more like this, where everything is mission accomplished and you're kind of sitting back and letting things move forward nicely here. So first of all, what is the VMSG dashboard? Let you know, it was developed here in Arizona with a couple of very large public health departments, and it was developed specifically for public health. We have never left public health. We've been with public health. Personally, I've been here since 2001 and never left public health. We enjoy working with public health. Our system is tailored for public health. And what it is in a nutshell is a comprehensive operational planning and execution system. Everything that you do is an operational plan. So you talk about your strategic plan, which are required for any accreditation, your community health improvement plan. Those are operational plans. What happens a lot of times is those plans get developed with a lot of expense, a lot of time by people. Get in there, everybody looks at it and says, boy, this is the greatest strategic plan we've ever developed. We love it. We're going to use it. The problem is that you don't have a vehicle in place to keep that plan up to date. So that's where the Deming or PDCA cycle, plan, do, check, and adjust, is our nomenclature. And we'll go into detail in that in a minute. What that does is basically keep the plan moving forward the whole time. Now, in the world of FAB, and probably in the Michigan accreditation, the Cycle 8, you're going to have a timeline on plans. So typically a strategic plan is 5 years, at least in the FAB world it is. And what happens is at some point in time, that plan is expired. By having this PDCA cycle, so you're continually updating the plan, typically on a monthly basis, the plan is kind of infinite. It goes on forever because it's always starting new as you do the update on it. Now, 2011, when FAB came along to issue the first accreditations, the health departments here in Arizona were given the fully demonstrated moniker by using our performance management system for standard 9.1 and measure 9.1.1a. So that, that's really a nice tool. And since then, there's about 240 health departments, bunches of them in Michigan using the system. And everybody who's gone through accreditation and done it the way we suggest, getting your 6-pack of plans in there, using the accreditation plan, using the real-time planning to engage everybody, has gotten fully demonstrated by FAB. So we're real proud of that. One of the reasons is that we have the ability to engage everybody in the department, including your external partners. When you get down to FAB 9.1.6, it says provide 2 examples of staff at all levels, including leadership and management, engaged in developing or implementing the health department's performance management system. So basically, you have to have everybody involved. Well, we have a tool called real-time planning that does exactly that. And you can automatically involve your external partners. And we're going to go into great detail on that. What is performance management in public health? If you Google performance management, you get 1,000 definitions. I'm going to give you ours. First of all, operational planning. So we have this little pyramid planning model. We'll go into detail on that in a minute here. You're going to develop your operational plans. As you're going through accreditation, typically you're going to start with something like the plans here in the bubbles, what FAB calls their 6-pack of plans in here. You're going to get those plans in the system. You can have plans for grant management, document management. You can have plans for FEP. You can have plans for community health, anything you want to put in the system. No limits on how much plan you can put in the system. So once you have the plans in place and you're executing them, you need to monitor them. We monitor at multiple levels. The macro level is the high level. It could be an entire plan. It could be your entire department. It could be one division. It could be community health. So the macro level is the dashboard itself. Now, as you're looking at that level, sometimes the details get buried in there. And that's why we have the micro level. So as you get down to the bottom of the planning pyramid where your objectives and activities, those are the micro level. So if one of those is going awry, you can see it long before it affects the major plan. VMSG Public we'll talk about here as well. That is the ability to take any plan elements, any portions of any plan, and build a public-facing web page literally in just a couple of minutes. It's a very simple process. We'll walk through that here in a minute as well. So that way you can take and share your current status, like here's how we're doing our strategic plan. And you take that link and maybe you email it to the board so that they can see for this month, here's how we're doing on our strategic plan or our accreditation plan or Cycle 8 plan, whatever you want to use. Very simple way to do it, but allows you to share what you're doing with the public. And then the PDCA cycle. The critical portion of this is that we're going to develop the plan. We're going to assign pieces of the plan to specific people. Those are going to be updated automatically by those folks. You're going to execute the plan. Every once in a while, you're going to go in and check the plan against the actual, and then make any adjustments necessary. We'll go through a live example of that here in a minute. Operational planning. The planning model, as I showed you here, here's a big picture of it here. The top of it, the organization is merely your health department. So typically this is one of those. Sometimes we'll have multiple, some big organizations divide up into multiple departments and things. Each organization then has a set of what we call groups. Groups are, number one, the structure of your organization. So the community health and FEP, WIC, and how they report in the organization, kind of the pyramid of your organization. In addition, these plans that you see up here in the bubbles or any other high-level plans that you have could be individual groups within themselves if they're high-level enough plans. Each group then has a set of services or initiatives. Services are ongoing things. Initiatives are things that you're trying to do in the future. Example, services, WIC is a service. WIC is a service that you've been provided forever and will continue to provide. Initiatives are a new plan that we're trying to do. We're going to use the example of building a tobacco cessation program kind of from the ground up today. Each service or initiative then has a set of goals. Each goal a set of what we call SMART objectives. Each objective a set of activities. And we're going to go through again live and go through detail on this. So the organization USA Public Health is our little demo organization. So I'm going to take you live into there now. When you log in, you're going to see a screen similar to this, and depending on your login permissions as to how many of these buttons you'll see down the column here. But if you'll notice this navigation tabs across the top, if you took that pyramid and flipped it on its left side, this is what you have here. So the organization, your health department, the groups, service initiatives, goals, objectives, and activities. I'm going to go down to my groups tab, and I'm going to look at the structure of our department, again, plus the primary plans up here. I'm going to go down to this group called Tobacco 2023. Now, everything to the right on these tabs is going to be within the group of Tobacco 2023. So I'm filtering it as I go down. So you see I have 3 initiatives down here. tobacco cessation, secondhand smoke, tobacco initiation prevention. For today, we're going to work on tobacco cessation. Under tobacco cessation, then we're going to have a set of what we call high-level goals. Goals, the idea of a goal here, it's typically an action verb followed by a few words. So it would be giving you an idea of what we're trying to accomplish without the detail. So reduce smoking in high schools. It tells you what we're trying to do. Reduce smoking in colleges. Reduce smoking in public areas. Now, if I say reduce smoking in high schools, that says, yeah, I kind of know what you're trying to do, but what I don't know is which high schools. What I don't know is when are you planning on accomplishing this? What I don't know is how much are you planning on doing the reduction? So that's where we get down to the next level here. Before we go there, though, you notice we have set a traffic light at this point. Traffic light is exactly as you'd expect it to be. Green means things are moving along as expected, go. Yellow would be slowing down. Something has caused us to slow down. Red means something came to a screeching halt. And then the gold bar would indicate successful completion. Now, you look at a goal like this, reduce smoking in high schools, you're probably never going to get to gold. You're probably never going to get to zero. In an ideal world, hey, wouldn't that be great if we got to zero and didn't have any smoking in high schools? But probably not going to happen. On each planning element, you have a set of notes over here. The notes is just an ongoing dialogue about what we're doing for that particular goal. If I change this to a yellow, I might put a note in there that says, John is going to be retiring next month. We have to find a replacement. So potentially it's going to slow the program down. This little button right here puts a date, time, and person stamp in front of that note. So I know who put the note in, when they put it in. So it helps you to kind of track things. The other thing we have at the goal, objective, and activity level is what we call a data source. The data source is just a link to a web page that is the data source I'm going to use to update this particular portion of the plan. In this case, it's the CDC Smoking Cessation Fast Facts webpage. You can set it to anything you want, by the way. This is the link. So I click on that link, pop open a new browser window, and there it is, Smoking Cessation Fast Facts webpage. This can be, again, any web page in the world. And what it is just the place you're going to go to get the information, if it's available, to update your plan. Why not have it at your fingertips if you're going to do that? So this is our goal, is reduce smoking in high schools. Now we get down to very specifics. The SMART objectives, SMART in our nomenclature is specific, measurable, attainable, realistic, and time-based. Primarily focused on specific, measurable, and time-based. So reduce smoking at Wayne High School by 25% by the end of the school year. So this is, Wayne High School, by the way, is my alma mater in lovely Dayton, Ohio. This is our target. This is exactly what we're trying to accomplish. You notice we've assigned this person, Steve Hansen, as our objective lead. The objective lead has two jobs. Number one, he's responsible as kind of the program manager to get us to this reduction. And number two, he's going to be the guy that updates this. He's going to get an automated email from the system, typically monthly, but you set it for anything you want. An automated email that says, Steve, go back in through what we call quick update to be able to update the status of this, update the traffic light, put any notes in there, and move on. So that is the responsibility of Steve and his responsibility to get us to this particular target. Now, underneath the objective, then, we have the steps that we're going to go through that we believe will get us to that target. Some people call them action steps. We call them activities. There are three types of activities in the system. Originally, it was just project-based activities when we first developed the system. And then over time, people asked for different variations. So we have a quality assurance activity and a quantitative measurement activity. I've got an example of each of them. I'll kind of go into a little bit of detail here as we go through them. So our first activity here is we're going to create training content and materials for students and faculty on the dangers of smoking. So every activity then has a performance metric. In this particular type of activities, you create the performance metric. And the performance metric merely is, how do I know when I successfully completed the activity? So I'm going to create training content. Once I've created the training content, hey, I'm done with the activity. Hence the reason the gold bar up here. We have a beginning and ending date down here. And then we have a notes field. So the notes field is just an ongoing dialogue about, how we're doing. So you notice it says completed chapter 1. You notice there's 4 chapters. So this was probably over here. Our measurement was probably 25%. Chapter 2, 50%. Chapter 3, 75%, then 100%. This is one of the options is a percent complete. There's a couple others, and we go into that. We get into the training. The other thing we do at the activity level is assign teams of people. So I'll go up here and pardon me 1 second. Okay, 3 columns over here: team member, team lead, email notification. Everybody who's working on this particular project, in this case, creating the training content's a team member. Diane is our team lead. She's guiding the team, if you will. Email notification, that's that real-time planning. So Diane is also going to get an email from the system to go back in through, again, quick update, to be able to update the status of her particular activity. In this case, how far along is she in creating the training content? If you're into a budget cycle or looking at grant dollars or things along that line, you can measure the cost of doing any of these programs using FTE or full-time equivalent. In this case, we're saying Diane is putting 10% of her time into this activity during the period of the activity. William is 10% and Andrea is at 30% of her time. What I can do with that is I can roll it up the pyramid. So at the activity level, it says we're at a 0.5 FTE. If I roll all 3 activities up to the objective, it says we're at a 1.0 FTE. So what that allows me to do is do kind of a cost analysis of what this program is going to cost. So maybe I can build it into the budget for next year, or I can go after grant dollars. Kind of a nice tool to be able to have, but typically only used during grant and budget cycles in there. The other thing you can do is add external partners. So here's our external partner database. Go in here and say VMSG Dashboard is our external partner for creating training content, and specifically Fred Erickson at VMSG Dashboard. I can have as many contacts down here and as many partners as I want. I can assign as many partners and as many contacts as I want. In this case, we just have Fred at VMSG Dashboard. Now, you can also make Fred a system user. And when you do that, then Fred can get an automated email from the system, and we'll train him on how to respond. Very simple. Train him on how to respond and update the particular activity that Fred has been assigned to. So that's our first activity. We're going to create training content. Our second activity then is we're going to take that training content, we're going to go to the schools and provide 9 training sessions each month on the dangers of smoking to students and faculty. This is what we call a QA activity, quality assurance. Unique in 2 things. Number 1, it's repetitive. So we set a frequency anywhere between weekly and every 5 years, and it repeats in that cycle. So we're always measuring in a new cycle. In this case, we're going to update it every month. So you see the start date was 11/1. The next start date would be 12/1, 1/1, et cetera, as we're going through the cycle here. In this case, our measurement is, we've actually done 8 training sessions. You notice down here it says green is greater than or equal to 9. So this particular activity automatically sets the traffic light as well based on the values you provide. So in this case, we're saying if it's, our target was 9, if we do 9, we're going to be green. If we're in between 6 and 9, we're going to be yellow. And if we're at 6 or below, we're going to be red. So that is the QA activity. Repetitive, automatically sets the traffic lights. Our third activity then is what we call a QM activity, quantitative measurement. Very similar to the project-based activity with one exception, and that is we have a target number. In this case, our target number is contact all 20 tobacco vendors within a mile of Wayne High School to make sure they're not selling to minors. By having that target number, then we can easily calculate our percent complete. So if we contacted 10 of them out of 20, it's going to be 50% complete. In this case, we got 20 out of 20, 100% complete in there. So that is the 3 activities and the 3 types of activities. Now, if we go back and take that through the pyramid, it looks like this. The group we selected was Tobacco 2023, so we're filtered to that group. Now we're going to filter it down to tobacco cessation. The one goal we selected was reduce smoking in high schools. Our objective, reduce smoking at Wayne High School by 25% by the end of the school year, and then the steps we're going to go through to get there. So this is the planning model. It's the same planning model for every plan. There are variations in nomenclature that we've seen, and we'll walk you through that when we go through the operational planning training in there. Now, we've got the plan in place. Let's walk it through that PDCA cycle, see how we might do quality improvement. So the plan's in place. Next thing we're going to do is execute the plan. So in this particular case, we're going to create the training content. Once we create the training content, we're going to take that training content, go to the schools, and provide those 9 training sessions each month. And in parallel with all that, we're going to go contact those tobacco vendors. In the background is that real-time planning. That's where the emails go out. So Steve gets an email every month that says, how far along are we in reducing smoking? Diane gets an email that says, how far along are you in creating the training content? William gets an email that says, how many training sessions did you do last month? So by collecting this information automatically in the background from what I call the horse's mouth, meaning the person who's actually doing the activity. So Diane is actually creating the training content or managing the team. She will know real time exactly how they're doing. So she doesn't have to go ask anybody to do that. It makes it very efficient to do that. So we're going to collect all that information, and we're going to use that when we get in the check phase. The check phase is comparing our plan to our actual. Our plan was 25%. Say that our actual is 25%. Let's go look at that. So if I go back to my objective here, which is a lot of times where you're going to check it, this little chart button right here is going to show me very simply the information I've collected over time. So Steve has been inputting this information, started out with 0 when we started the program, got up to our 25% reduction and holding at 25%. So at this point in time, our actual is 25%. That's great. Back to PDCA. So that was our check phase. If you're collecting this information in the background, it's that easy. If you're not, you've got to go collect the information each time before you do the check phase. It's a pain. Now, once we do the check phase, we're going to make any adjustments if necessary. Well, from what we can see, it's working great. Why would we make any adjustments? We're not. We're going to continue through the plan. We're going to continue to execute. Once in a while, we'll go in and check it and keep through this cycle. Let's assume for a second that our actual was only 21%, not 25%. So now we got to make a decision. Were we a little bit too aggressive on our planning? Was 25 just too high to get to? If so, maybe we'll take the plan down to 21 and continue through the cycle to keep it there. Maybe we think we can get to that 25 still if we add additional resources. So maybe instead of 9 training sessions a month, we do 12. Maybe there's 25 tobacco vendors, not 20 out there. Maybe there's a whole set of activities we hadn't even thought of yet that we can put onto there to get to our 25%. So that's adjusting the resources. Then there's a fourth option, and that is maybe the plan is just a little too high. Maybe 23 is a realistic number. And then maybe we can get to 23 by just adjusting the number of training sessions we do to maybe 12, something like that. So those are the 4 options in here. But by doing this cycle, like I say, on a monthly basis, your plans are always up to date. So you're always working with real-time information. And in the case of your strategic plan, your chip, et cetera, if you're keeping them up to date here, basically you're starting the life cycle of the plan every month. So that plan will kind of have an infinite life cycle in there. Now, I showed you micro level performance monitoring, the chart we just looked at. That was at the objective level. This is macro level performance monitoring. This is the dashboard. So we'll go back into here again. So I'm going to go to my groups tab. When I log in, I'm assigned to a default group. So in this case today, I'm going to be the community health director. When I log in, it took me to community health. I don't even need to go to the group screen. All I need to do is click on this traffic light button in the top right corner up here. What that's going to do is give me the dashboard, the current performance of community health. Now I can also go in and select any group in here, any plan in here, and get my dashboard for that particular group or plan. Here's what it looks like. Top left corner, I call this the big picture. This is showing me the number of traffic lights in each status, and you'll notice it's clickable. So I can drill down on anything here. If I want to see what this red activity was, I can click on it, maybe make some adjustments, get it back on track, whatever it happens to be. I can look at the 3 bottom levels of the pyramid, goals, objectives, or activities. Over here, I have a schedule gauge, and what that's showing me is aggregately, we are 49 days behind schedule for these 23 activities. When it gets to 60 days behind schedule, it turns red. When we get on schedule, it turns green. So up here, by looking at the colors and the numbers, you get a good snapshot of performance. Now, if I want to drill down, I've got 3 different drills down views at the bottom. First one is my people. How is each person performing against their assignments? This first column here is the last time this person did their update. So you can see the different color codes. Green is less than 30 days ago. Yellow is 30 to 60, and red is over 60 days. Now, there's an old adage that says, people listen to what you say, people do what you audit. Consider this to be kind of a mini audit. So I'm the community health director. I'm having my monthly meeting with my staff. I get up on the screen with this chart up here, and I explain to them what this is all about. This is Fred is, green. He's been in within 30 days, and Diane hasn't been in between 30 and 60 days. And then we got Tom and William who are at over 60 days. I will guarantee you the next meeting, all of those will be green. People do what you audit. FTE, this is a roll-up of the FTE value by person, which is kind of cool because now you can look at the loading of each employee in here. In an ideal world, you want to keep them down around that 1.0 level or lower, but if you say you get up into 1.6, you're doing a lot of overloading on some of these people, 2.3, 3.3, whatever, demo numbers. So lagging says I have activities that are calculated to be behind schedule. The days column is the same as this one up here, but for the person. So Diane is 1 day ahead of schedule across all of her activities, and Andrea is 30 days behind schedule across hers. Overdue says I have activities that are past the ending date and not yet 100% complete, and then the number of red, yellow, green, and gold for that person. So that's my first view as my people. I have 2 additional views. Groups will show the group screen, so the group that I've selected, in this case community health, and its subgroups down here, and the same data points over here. My third one is my priorities, strategic priorities. That would be the services and initiatives from your strategic plan. Typically, there's somewhere between 3 and 7 of them down this column. And what we're doing in this case is mapping those against every other plan in the system. When we get into the training, 3-dimensional planning training, we talk about that, how we actually do that. So this is the drill down at the bottom here. Top right corner are specific things that you want to keep your eye on. There's more like a bookmark up here. We call them my priorities. You can select any objective, so those targets in there. I can select any objective to appear up here on my login. Typically, the things that are yellow and red, because if they're green and gold, they're on track or are completed in here. If I click on this, there's a little green flag on the objective screen. I click, takes it off. Next time I come into here, it's gone. I can pick any ones I want that I have access to across the whole system. And again, when I'm done, I can take them off there. So it's just a nice way to keep track of things that are kind of on your mind, if you will. So this is the dashboard screen, macro level. You can do a lot of these same things on your phone now. So this is what we call VMSG mobile. That's the same screen you just saw is broken down into 3 phone screens just for real estate purposes. This is what we call a dynamic app. You do not need to download an app on your phone. So if your IT people have trouble with that kind of stuff, you don't need to worry about that. It actually builds the app just like it did on your desktop in the browser on your phone. You use the same link and the same login credentials. It just knows you're on a phone, so it picks up this app. Top left, bottom, top right corner. Same exact functionality. You can drill down on anything on here, but it's available on your phone if you're not sitting in the office all the time. So what we just went over is what we call the core functionality of VMSG. From a perspective of FAB, anyhow, and it probably relates to Cycle 8 as well, the people who've used our system have gone in and implemented the FAB 6-packet plans, the ones that you saw in the bubbles, used one of our plans to get through the accreditation process, and implemented the real-time planning so that you engage the staff, has gotten that fully demonstrated moniker from FAB, which is the highest level of compliance for 9.1 in here. So that is the basic functions. What we're going to go into now, after I pause for questions, are some of the additional functions that have been added over time. But are there any questions on what you've seen so far? And Andrea's joined us here, so say hi, Andrea.
Hello.
Hi, Andrea. You mentioned, am I understanding it right, that this comes pre-populated with the accreditation Cycle 8 tool?
Yes, it does. I will show you that in a few minutes here.
Okay. And then, what's the average build-up time that it takes an agency? Because you mentioned, this, obviously, we have a strategic plan. That would be one of the first things that would go in.
Yeah, what we're going to do, Jamie, is we're going to walk you through the training. The first training session is an overview, similar to what you're seeing today, but with more detail on logging in and things along that line. The second training is how to develop or how to enter an operational plan. We actually walk through the process of entering it. Then we turn you guys loose to actually create either something you already have, like your strategic plan, putting part of it in, or creating a simple little fun plan, about summer vacation or whatever you're going to be doing. We have all kinds of stuff. And then we have a session where we kind of grade that a little bit. And then we go into performance management training, performance monitoring training after that. But once we go through these trainings, you'll find that it's really very simple. And what you want to start out with is the primary plans for Cycle 8 that you're required to have. So get those in the system to start with. The Cycle 8 plan will already be in there. What we'll do is assign the people that you tell us are the leads for each level in there, for each section of the plan. We'll assign those. We'll assign the dates that you say, hey, we're planning on submitting at the end of December of 2024, whatever it happens to be, and it will assign those. That then turns on the real-time planning so that all those people will be automatically updated on what they're supposed to be doing towards the accreditation.
Okay, thanks.
And it's really, once you get entering the plans, I do this all the time, and it's a very, very short cycle, because basically if you have an existing plan, you're copying and pasting it into the system. If you're developing a plan, it's really a nice tool to walk you through the development of the different levels of the plan. Okay, go ahead.
Jamie, it looks like your site review is going to be August of 25, and as far as getting you up and running, it's pretty quick. And I think by that time, I didn't know if you also simultaneously going to be approaching FAB at all.
Yeah, at this point, we're not considering FAB.
Okay.
But yeah, our site review will be August 25.
Okay, and then with that said, what we normally do with our Michigan clients is we train them. It's called, and this is not off topic, it really goes along with it. After you get up and running, we'll start training you how to tag those efforts, whether it be now or 5 years from now, whatever you're doing on cycle 8, we'll somewhere along the lines be able to tap into the elements of FAB. So then in the future, if you decided to go towards that, you can click it on. We have one Michigan department that's doing both at the same time. So it's kind of interesting, but I'll keep quiet. Fred, go ahead. I'm sorry.
Thanks, Andrea. Okay, let's go ahead and move forward. Intelligent document management. For years, this was just called document management. And as you're going through your accreditation cycle, as you know, you're going to submit hundreds and hundreds of documents. Whether it's FAB or whether it's cycle 8, you're going to commit these. We have the ability to attach documents, and what you'll do in this case is attach them into the cycle 8 plan right where they belong. So you always have the documents exactly where you need them. They're stored up on our secure servers. They're backed up every night. Never have a chance of losing them. Don't have to go finding them because they're exactly where they need to be in there. Now, a couple of months ago, probably about 6 months ago now, your friends up at Branch Hillsdale came to us and says, we have an issue we think you can help us solve. We have a bunch of policies and standard operating procedures and memos of understanding that have to be updated on a regular basis. And we know who's supposed to be doing the updates, but what we don't have is a linkage that says John has got to update this plan by the end of June. So what we did is we built the capability into document management to allow you to create a special activity that says this particular plan is assigned. In fact, I actually have an example here. Let's say we have a group called Administrative Services. We create a service called Department Policy Review and Revision, manage and update all administrative policies. The objective, review and revise the administrative policies as required. And then we got an activity we call a timeline activity. Review and revise the 24/7 coverage policy number 0802 annually. And then you attach the document to the activity. The activity is then set up for an annual cycle. So it's like that QA activity where it's cyclical, an annual cycle, and then you say % to yellow. In this case, let's say we call it 80% to yellow, meaning at 80% of the way through the year, Fred will get notified that he's supposed to be updating this particular policy by the end of the year. If it gets to the end of the year and it hasn't been updated, it turns red. Everybody gets notified. If he does get it updated, then it goes back to green, and you're starting the new annual cycle in there. You can have as many of these documents in here, as many things as you want, as many people assigned, but it really does kind of automate the process. This has become a huge point with all of our customers now because everybody had the same problem that Branch Hillsdale had. So most people are using this to manage documents in here. Three-dimensional planning. This is something that we go into after you've got most of your plans in the system to talk about how to interact your plans. What it does is ties your plans together through a set of categories and subcategories. So for instance, you might want to know, what are we doing related to public health essential number 1 across the whole department? And by the way, this is just an example of the plans. You can have all of your plans attached in here. In the FAB world or the cycle 8 world, you can say, hey, I want to know what are we doing related to standard 1.1 or section 1. And I want to know how I can look at everything we're doing across the whole department related to that. Our strategic priorities, this is what we do at the bottom of the dashboard screen, is taking your strategic priorities and mapping them against every other plan in the system. And then the documents. So you're going to have a bunch of documents out there. You can tag the documents against the standards or the FAB, in this case, the FAB standards or measures out there, so you know exactly which documents you're going to be submitting out there. Again, it's a pretty short training, but it kind of feels a lot better once you have your system together and have your documents or have your documents and your plans up to date in the system here. Real-time planning. This is the key element to 9.6.1. And I'm sure that Cycle 8 has similar requirements in there to get everybody involved in it. So what happens is this is typically set for a monthly cycle. So let's say we set it for the first Monday of the month. First Monday of the month at 1 a.m., the system goes in and looks at everybody who is assigned as an activity lead or an objective lead anywhere in the system. And it looks at them and it asks 3 questions. Number 1, has this person updated their stuff in the last 30 days? Number 2, does this person have anything that has fallen behind schedule? And number 3, does this person have anything that's overdue? If none of those are true, no emails go out, no spam. If any of them are true, the emails go out. Emails can go out to internal folks as well as external partners. So if you have external partners helping you with your chip or whatever, they can directly go back into the system and update it through a limited interface we provide. Now, in that email is a link that takes you back in, and you're going to get a dialog box because you're an objective activity lead. In order to get this email, you have to be. And the dialog box is going to say, hey, do you want to go back to the main menu or do you want to go to quick update? If you select quick update, it's going to give you a pair of screens, activity quick update and objective quick update, that are super simple to update the particular planning elements. And then you're going to log out. This timeline, if you assign it down to the people who are actually doing the activities, typically takes between 3 and 5 minutes per person per month. So it's a very efficient way to keep that information up to date, keep your plans up to date in there. Now, the activities quick update screen, it looks a little complex, and the only reason that is because the top of the pyramid is included here. The group, service, goal, objective. So it's perspective. We says we have activity 1 of 29 down here. But the nice thing is, as you're updating it, you're going to update the traffic light by cycling through it with your mouse. Update the data value, whatever percent it is. You're going to put in a note. You can see the time and date stamp note up here that was put in here. You got access to your data source if you want it in here. Hit the next button. You're going to cycle through those activities. If you're an objective lead, you're going to get a similar screen for objectives, cycle through those, log out, done for the month here. And you can do that on your phone as well. So these are a little bit less, obviously less context on here because of screen real estate, but exactly the same login, the whole 9 yards, and you can go through your activities, go through your objectives, log out, and you're done here. Reporting. There are a boatload of reports, and we go through all of them in detail through the training here. But the most common report is this top one called an operational plan report. And the operational plan report for the tobacco program we're looking at would look something like this. The group was Tobacco 2023. The initiative was tobacco cessation. The green indicates there's a document attached to tobacco cessation, as you can see. You can have as many of these attached as you want anywhere in here. We have a goal of reduce smoking in high schools. Here's that data source we had that takes us to the CDC smoking cessation webpage. You got the objective, you got the objective leads, got the activities, the traffic light status, all the notes, all the people, everything you want to know but we're afraid to ask. This is an extremely detailed report, probably most relevant to somebody like Steve, who's responsible for getting all this done. Everybody else usually just kind of wants to know, hey, how are we doing on the tobacco program? That's where VMSG Public came from. So if I click on this guy here, it's going to open the VMSG Public page for the tobacco program. And it'll look kind of like this. This is the initiative, tobacco cessation, and it shows you that we have 3 gold and 1 green, 1 yellow, 1 red, and we're 51 days behind schedule. Now, as I break that down, so the first goal, reduce smoking in high schools underneath that. And again, you can do the rollovers here and see the timeline. And I can get all the way down to the activity level. So it shows me the little timeline for the activity that we did 9 training sessions, 9, drop down to 6, etc. down here. So this is, again, we go over how to do this in our performance monitoring, but it's a super simple thing. It'll take you 5 minutes to do this. Once you get this link created, you can take and email that. So maybe you email it to the board and say, here's the status of our strategic plan for this quarter. You have your IT folks put it up on your public-facing website so partners and clients can go in there and take a look at it and see how you're doing on tobacco program or whatever program it happens to be in there. So it's just very flexible to be able to do that anywhere you want. Okay, one more quick section to go through. We're going to talk about the accreditation plans, but are there any questions before we do that? Okay, let's go. Accreditation, reaccreditation plans. Let's go to the group screen here. So down here is the Michigan Cycle 8 plan. And you can see down below it all of the accreditation plans for both the older version 1.5, which some people are still using, and the FAB 2022 accreditation and reaccreditation plans. But if we start drilling down through the Michigan Cycle 8 plan, we'll get down to here and we have the sections. So here's the sections, and kind of weird that section 9 is missing, but that's the way it is in the documentation here. So these are the sections under here. Underneath that, you have NPR 1. By the way, we link back to the state documentation here. So you've got a link right back to the NPR 1 state documentation. So you've got the horse's mouth right there available to you. Let me close that. And then under the NPR, we have the basically the 8 objectives to get to that point in there. And here's your objective lead that you're going to assign in here. So these are the people typically at the section level. Again, we have the data source link down here. And then underneath that, you're going to have the activities that you need to complete. You got the activity dates down here. So what we'll typically do to get you started is you'll tell us who you want to assign at whatever level, but typically it's at the section level. You say for section 1, it's all Fred Erickson. So we'll push Fred's name all the way down to the objective and the activities. Then you're going to say we're going to be submitting the end of August. So we'll put the end of maybe July or end of August, whatever you want, end date on there. And by doing that, by having the person and the dates in there, the real-time planning starts getting engaged. So the people who are designated as the leads here will get automated email notifications saying you need to go back in and update this particular portion of the plan, attach all the documents and everything in there. Your documents are attached at pretty much any level down here. So right here is the document management. I would click on that. I go in here and say add a document. I can choose a file. I'm just going to pick a random file here, VMSG test. And I'll just pick a partner list. Open that up, upload it, and then I'm going to put in a description. The actual file name is down here. You can put any notes about it, set the traffic light, whatever you want. I'll go ahead and say it's green and save it. So this document is now attached to that particular plan element. I can go back to the plan element here. I can attach as many documents as I want in there. Once you got them all in there, you know exactly where they are, where they belong to be, and where they're attached. This is something else that's kind of cool to do. A virtual mock site visit. So now if there's somebody that you know, maybe one of the other health departments who's been through Cycle 8 and really understands the program, you might want to hire that person or somehow engage that person to come through and go through your plan in a virtual mode. So they can come in remotely. They can walk through every element of your plan. And what they can do is put a review up here. So this is a review pane that opens on the activity screen. They can go up here and they can say, this is great, everything's good, mark it as green, or your strategic plan will be expired by the time you submit it, mark it as red, whatever you want to do. So they can go in remotely and grade it for you. Then there's a report that you generate called the Accreditation Review Report. It'll have all of your stuff plus all of their stuff. You can kind of make sure that you're all ready to go for the final site visit or turning in your program there. Quick start. As I mentioned, we are only in public health, so the system is very simple to bring up for public health department. We need 3 pieces of information from you: your org chart, your user list, which we provide you a spreadsheet, you fill it out and send it to us, put them in there, and the graphics, which is just your logo and your page header to personalize things. And then we start with a training. Once we get your system up and running, which basically takes a day, get your system up and running, we start with the introduction. So a version of this that we're doing today for everybody on the team. We want everybody to understand the overall view of the system before they start getting down into details, so that as you're talking about different things, they understand the logic and the models and such. The next training we do is operational planning for those folks who are actually developing or entering operational plans. And then at the end of that, we request each person go away and create a plan of some sort. And like I say, it can be fun, it can be business, whatever you want to do. We've had all kinds of cool stuff in there. Your team goes away and enters their operational plan, typically about a week. Then we go back and do a review training where we actually walk through the plans that they entered or created. We'll have them enter the plan if they haven't entered it already, and just so that they got their hands on and they understand the planning process. And we do performance monitoring training. So every micro level, macro level, VMSG public, reporting, all of that stuff is included in the performance monitoring training. And we provide ongoing training. If you get new people where you have turnover, somebody retires, whatever, we will train those people for you. And all the training is done at no cost. That's all included in the program. Everything, in fact, is included in the program. Now, some people like to do their training online. They may not have time during the day or whatever. They want to do it in the evening. So we built all that training and help right into the system. So I'm at my services level here. And if I want to know anything about anything on this screen, how to add a service, whatever I want to do, I click on the blue eye. It's help and information. It takes me right to adding and managing services. And these are the steps for anything you're going to do in the system right here. So you're going to walk through these steps, or there's a training video right here, about 5 minutes long, on how to do that. There's the complete user guide for the entire system right here. It's a hyperlink PDF file. You can dock it on your desktop. You can print it, whatever you want to do with it. As you just get started with the system, this is a good read. This is implementation guidelines. It's the good things and the bad things and the IT things and definitions of how to enter plans in the system. It's pretty much everything we've collected over the years from our clients. So they've given us feedback. We included in this document and have made a lot of changes based on that as well. But it's a good starting point to understand how to get things moving in the document here. In addition, up here on the top are 5 training modules. The introduction, we like everybody to go through so they understand what the system's about. Basics, and then we go into operational plan training, performance monitoring training, and administrator training for those of you who get designated as admins. This is about managing user profiles and permissions and all that kind of stuff in there. So all of these training, if you go through all of them, it's about 3.5 hours, but they're all complete training modules built into the system. We do prefer taking you through live because we like to have the interaction and the questions and that sort of thing. But for those people who don't have the time to be on live or want to go through it at evening or whatever, it's all available to them 24/7. Real quickly, benefit summary. I'll show you the price model here. The system is very cost effective. The dashboard allows you to manage any portion of your department or the entire department on one screen. Real-time planning, kind of required, for accreditation, is to collect all that information in the background. 3D planning we'll get into after you get your plans in there to talk about gaps and commonalities and overlaps and such. All the accreditation plans are built into there. The system is completely cloud-based. You don't need even a plugin on your browser. You just need to have a standard browser in there. And then VMSG Mobile, again, is browser-based, so it'll work on any phone. Again, you don't need an app to be in there. So that was your drink out of a fire hose.
Ta-da!
Questions? I think everybody drowned.
Yeah.
No, I think I've seen a brief overview of this. I think it was Teresa Fisher, Branch Hillsdale St. Joe, about a year ago, brought this to administrators for health departments. So it's been something that's been on my radar, is something to look further into. I think this gives us a good overview of what services it could provide and the benefits it could bring to our agency.
I think we did like an association overview for about 40 people, I think.
Yep.
And did you get pricing at that time?
I don't recall. I'd have to go back to my folder. I don't remember.
Oh, you bet. I'll just give you a pricing really quickly. Fred did all the hard stuff, and I just come whisking in. I don't know if he told you, but saw a friend on the freeway with an accident. So I was like, okay. So what we did, we designed it so that it's kind of tiered up. It looks like your jurisdiction is about 175,000. Is that correct?
It's a little over 150.
Okay. Okay. So, you know, it depends on what we have said that in the past, especially if you're going to go through your Michigan accreditation, usually about 70% of your FTEs are involved in something, updating an activity, doing an activity, the objectively. And so if, let's say, for example, you have about 65 FTEs, and you would probably want 45 people, users on the dashboard. So it starts out like this: 1 to 50 users on the dashboard is $100 per user per year. Then if you add one more, which you probably wouldn't have to, it goes down and it cuts in half to $50 per user per year. And then it cuts in half again at 125. I'm trying to think of departments that are your size. So how many FTEs do you think that you have right now?
So we have roughly, we have less than 55 employees total, and a portion of those are part-time.
Right, then you wouldn't even need that. So, you know, 35, 40 users on the system. And that pretty much includes everything. We haven't changed our prices ever. So pretty simple. And then the training, there's no cost for training. And that's ongoing. I always like to, right now we're pushing through our Michigan clients with now the ability to do what I mentioned before, the 3D-dimensional planning, being able to categorize everything so you don't have gaps and overlaps and commonalities. You can just kind of put it in one report. And that's about it. Is there any questions on the training or the system itself?
I don't know if any of the rest of my team has any questions.
I know, you know what, you guys, it is a lot. That's why we call it a drink from a fire hose. We chunk it down during our training, and it doesn't necessarily mean that everything in the system you're going to use all at once. It's a building process. I like to call it getting your white belt to your black belt during the training.
Mm-hmm.
Well, that is
a quote, Andrea.
Yeah, I'm gonna, Jamie, I'll go ahead and send you a copy of this. And if you need anything else, please feel free to reach out, and I'll send you whatever you need. And, you know, God willing, we'll be able to, you know, have you guys being a dashboard user.
Great. Yeah, thanks. I'll do a debrief with everyone who was on the call today, and we'll do some discussion on the benefits and go from there.
You bet. And you guys have a great day. I'm so sorry I was late.
Oh, not a problem.
Okay.
Thank
Take care.
Fred.
Bye.
Bye.